Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. Federal government explains delay with deployment of Moderna vaccines to states. As more states flag off second phase of inoculation exercise, Edo government announces compulsory vaccination for residents. And U.S. donation of COVID-19 vaccines arrive in Israeli-occupied West Bank and Gaza. Active cases has risen to over 16,000 according to the Nigeria Center for Disease Control after it reported 565 new confirmed cases and 8 deaths in the country. With test samples approaching the 3 million mark, the NCDC said the reported figures also include a backlog of cases from Benue State reported August 17th to 19th, 2021. In the meantime, the agency has published its 2020 annual report detailing its work leading the public health response to the COVID-19 pandemic and other diseases. It also describes the activities in the reporting year that strengthened its capacity to prevent, prepare for, detect and respond to infectious disease outbreaks and public health threats. Let's now take a look at the virus update.
The highly transmissible Delta variant of COVID-19 has continued to fuel more infections in Nigeria, but adherence to public health measures remains the basis of the pandemic response. Within the last 24 hours, the NCDC announced 565 confirmed cases reported from 13 states and the FCT. Lagos had the highest numbers with 205 cases, followed by Rivers with 73 infections. 63 cases were recorded in Ondo, 53 cases were reported in Oyo and the FCT. Ekiti had 37, while 24 cases were reported in Delta. 20 cases were registered in Edo, Benue had 12, Bayelsa, Kwara and Osun had 6 cases, Ogun had 5, while Adamawa registered 2 cases. There were 0 cases reported from Cross River, Gombe, Kaduna, Kano, Nasarawa, Plateau and Sokoto states. The latest update also includes a backlog of data from Benue State on the 17th, 18th and 19th of August. Nigeria now has a total of 187,588 confirmed cases. 363 people have been discharged in the last 24 hours, increasing the total number of recoveries to 168,818. The NCDC also reported 8 additional deaths from COVID causes in the last 24 hours, raising the fatality toll to 2,276. Presently, there are more than 16,000 active cases in Nigeria, while over 2.7 million samples have been tested so far. In Africa, there are over 7.5 million confirmed cases, and more than 189,000 deaths have been recorded across countries on the continent. The total global confirmed cases have now surpassed 212 million, while more than 4.4 million deaths have been reported.
The federal government has been explaining the delay with the deployment of Moderna vaccines to states after they were certified safe by NAFDAC. Now, addressing journalists at the bi-weekly vaccination update in Abuja, the executive director of the National Primary Healthcare Development Agency says that the delay was due to lack of proper coding for tracing and tracking. He, however, notes that 29 states have so far received this shipment, as he appeals to state governments to scale up the vaccination exercise in their states.
Our focus has been on distributing the range of COVID-19 vaccines, Moderna, Johnson & Johnson, and AstraZeneca to the states, as well as concluding the training of state and LGA personnel to ensure optimum vaccine utilization. So far, we have deployed Moderna vaccines to 29 states. It is pertinent to state that we could not deploy the vaccines immediately after NAFDAC certification because unlike the AstraZeneca vaccine, the Moderna vaccine did not come with complete barcoding. And this is absolutely needed for us to be able to track and trace the vaccines. Now that the vaccines are in the states, we're counting on our governors to continue to provide the needed oversight and resources that these vaccines are secured and maintained in the required temperatures, and that all eligible persons are mobilized to access the vaccines to protect themselves, the families, and their communities against COVID-19.
And some of those 29 states are indeed taking deliveries of the Moderna or AstraZeneca vaccines with the same message that the Moderna vaccine is new and for people yet to take any COVID-19 vaccine, while for states that also received the AstraZeneca vaccine, that it is for only persons who have received the first dose. This next report captures Nasarawa, Zamfara and Edo states.
The vaccination drive is gaining momentum in the country as more states receive their own consignment of the AstraZeneca and Moderna vaccines. At an event to flag off the second phase of the vaccination exercise in Edo State, the state government announces fresh COVID-19 sanctions, including compulsory vaccination for residents. The Edo State Governor, Gadun Obaseki, says the measure has become necessary following the low vaccination rate in the state so far.
Beginning from the second week of September 2021, large gatherings, as well as high traffic public and private places, will only be assessed by persons who have proof of taking at least one dose of a COVID-19 vaccination. People who are not yet vaccinated at all will have to depend on remote access to these gatherings.
Close to 66,000 doses of the Moderna brand of COVID-19 vaccines were donated to Zamfara State by the United States government through the Federal Ministry of Health. The vaccines were received on behalf of the state government by the chairman COVID-19 task force, Nasiru Magaria, who gives an assurance that efforts will be redoubled to control the spread of the virus in the state.
I'm assured with the task force committee under my watch and the Ministry of Health and collaboration with the Primary Health Care Board, we are to go around to see, to monitor the exercise, and local government by local government, plus by plus, word by plus. I'm assure you that we are going to support you as you have very good expectation to us.
The Permanent Secretary supervising the Zamfara State Ministry of Health, Habibu Yelwa, gives the state a pass mark for the first phase of its COVID-19 vaccination using the Oxford AstraZeneca brand, expressing optimism that the Moderna vaccines will also be deployed successfully.
We'd be able to cover all, to finish up, to exhaust all the consignment that we had. And not only that, also, we were given additional doses, which at the same time we were able to exhaust. And that is why it has been said by the representative of the NPSCDA here that we are having this much number of doses, more than our neighboring states.
Representatives of the National Center for Disease Control and National Primary Healthcare Development Agency commend the state government for its efforts to contain the virus.
This vaccine is meant for the new group of people, not the people that have received before. Because the COVID-19 is real, and it's good for us to protect ourselves so that the disease cannot spread around.
Meanwhile, health authorities in Nasarawa State are flagging off 97,000 doses of Moderna vaccines alongside 7,000 doses of Oxford AstraZeneca.
I don't have any doubt within me and my management team that we are going to take the front position when it comes to vaccination, because we have a government that is ready to give all the necessary support to make sure that the rollout is very fast and fantastic.
Residents of Zamfara and Nasarawa states who are eligible to receive the Moderna COVID-19 vaccine are those who have not taken any vaccination against COVID-19, while the Oxford AstraZeneca doses are for those taking their second shots.
Well, joining us for more on the COVID-19 situation and rollout of vaccines is Dr. Betta Edu, Cross River State Commissioner for Health. I'd like to thank you for joining us on the program.
Thank you for having me. Good evening.
Good evening. As chairperson as well, Commissioners for Health in Nigeria, how would you assess the current response to tackle the third wave in the country?
Well, I think Nigeria has gotten used to responding to the COVID pandemic, and the third wave isn't any worse than it has always been. At least we have some basic knowledge on how the response should go, and we have been able to effectively manage 2 waves of the COVID-19 pandemic. Most important is the fact that we now have the vaccines in the country, all the commissioners for health across the various states, and indeed the health ministries have been doing a whole lot of work on the grassroots to see that people are tested, to see that they continue to maintain the protocols which have been laid out by NCDC and the federal government, including the Presidential Steering Committee, and then also to push the vaccines in the various states. A lot of work around risk communication going on in all the states presently. We are very grateful to the federal government and, of course, the Presidential Steering Committee for the great work they have done in giving direction to various states. And we believe that as we're able to overcome the first and second wave, we'll do same for the third wave, vis-a-vis the fact that we have vaccines now in Nigeria.
We've heard today from the Edo State Governor, who has said, from the second week of September, there will be reinforced public health measures, such as that, for those who can access for large gatherings and, accessing public and private places, only for those who show proof that they've taken at least 1 dose of the vaccine. Is that something you're open to in Cross River as well?
Well, we can't really place that kind of embargo on people. We advise people generally to follow the protocols and do what is right in their own interest and in the interest of the public. However, because of the limited number of vaccines that are available, it's difficult for us to say everybody must have the vaccines before they go to public places. If you recall, Cross River State did extremely well, very, very well, during the first phase rollout of the vaccines. We had over 117% coverage, topping the country for the number of population covered that was targeted. And we again are doing the same thing during this second phase. We already flagged off on Saturday, and we're pushing all the vaccines out across the hinterlands everywhere so people can have access to the Moderna and AstraZeneca for the second dose, Moderna for the first dose. And then, of course, risk communication is on top gear to ensure that more and more people have access to these vaccines. However, because of the limited number, you can't say that everyone who has not taken the vaccines can't really be in public places. But more importantly, they should be able to use their face masks when they are going to public places and try their very best to avoid crowd and all of those kind of gatherings that could put them at risk.
You've also been of the opinion that for those that haven't or are not going to use up their vaccines, they should send it to states that actually need more, which is something that we saw during the earlier rollout. Will this apply here as well? Is that a position you also want to happen?
Well, Cross River State has continued to absorb vaccines from several other states. During the first phase, we exhausted the first 58,000 doses that was given to us within 10 days. And so we had to call for more. They sent another 8,000. And then subsequently, they pulled vaccines from other states in South Nigeria and sent to Cross River about 25,000 doses, which were exhausted within 7 days. This time around again, we have started, and the numbers that are coming all out to get vaccinated are really, really huge. In a day, we run more than 5,000 to 8,000 persons getting vaccinated. And with the rates we're going, within 20 days, we would have exhausted the Moderna and then the second dose of AstraZeneca. And so we have no options than to call the national to send in more vaccines into our state so that people who are itching, yearning, and really calling on the response team to give them vaccines can have access to these vaccines. Remember, they have very short shelf life, and so they need to be given to people as soon as possible, especially the AstraZeneca vaccines.
So in 30 seconds, you almost sound like there is nothing like vaccine hesitancy in Cross River State. Is that the case?
Yes, we have no single form of vaccine hesitancy. If there's anything, we believe that the vaccines that we have received already, we would exhaust it and we'll need lots more in a very short time. And we're very happy that the Johnson & Johnson is still coming in for those conflict areas and hard-to-reach areas. And also we're expecting more of the AstraZeneca vaccines and Pfizer vaccines as soon as possible. The governor has asked that the the ultra cold chain be kept in the government house so that they are assured of 24 hours flight. We have no issues whatsoever. Logistics provided and vaccines are going all out.
We appreciate your time on the program. Thank you so much. Wish you all the best. Dr. Betta Edu is the Commissioner for Health, Cross River State, also the Chairperson, Commissioners for Health in Nigeria. Thank you for joining us.
You're welcome.
Still ahead on the program, health worker in Johannesburg charged for allegedly selling fake COVID-19 negative test certificates to travelers. Please stay with us. In Katsina State, plans are underway for the commencement of the second phase of the COVID-19 vaccination exercise scheduled to hold next week across 34 local government areas of the state. Efforts have also been intensified by the state government in sensitizing the residents against contracting the highly contagious Delta variant of COVID-19. The Executive Secretary of the state's Primary Healthcare Development Agency disclosed this in an interview with Channels Television.
Anybody that has not received, as long as you are 18 years and above, you have the opportunity. When we finished the first dose of the AstraZeneca, many people were coming when it was almost late, when the vaccines have finished, or when we are advancing the second dose. But now it's an opportunity for them. They are going to have their own, and all the LGAs, we have some designated centers. And for those that have received the first dose of AstraZeneca and they are yet to receive the second dose, before the end of this month, we are going to get the second dose and we'll let them know so that they will go to the respective centers, vaccination centers, and get their own.
Outside Nigeria, a health worker in Johannesburg has appeared in court after being arrested for allegedly selling fake COVID-19 negative test certificates to travelers for 500 rand. That's about 17,000 naira. He appeared in the Boystons Magistrate Court, Johannesburg, on fraud charges. According to the city's Group Forensic and Investigation Service, he was closely monitored for over a week and arrested during a sting operation, which was led by the city executive mayor councillor. It is alleged that the suspect sells the fake COVID-19 negative test certificates to people wishing to travel to other countries without conducting the actual test and taking blood samples.
A 28-year-old employee from the city of Johannesburg, Skhumbuzo Manana, appeared at the Boysons Magistrates Court earlier today, facing charges of contravention of the Medicines and Related Activities Act, fraud, uttering, and possession of suspected stolen goods. He was released on bail amount of 3,000 rands, and the matter was postponed to the 17th of September 2021 for further investigations. The court further ordered that Manana should, within 24 hours, submit all his traveling documents to the state.
Well, Dr. Lara Roberts, a public health physician, joins us now. Thanks for joining us on the program. I mean, that is South Africa, but look at the report we got in Lagos that over 1,000 persons said to be from high-risk countries have absconded. I mean, why do you think this has happened, and are they not aware of the risks, one to themselves, to those vulnerable around them, or even the possibility of sanctions?
To be honest, thank you for having me and good evening. I really do think it's unconscionable what people are doing and how people are trying to take advantage of what is already a terribly horrendous global pandemic situation in which we find ourselves. I mean, I think that, the governments, the authorities will have every right to come down extremely firmly and harshly on anybody who is caught breaking the rules. We've worked too hard to be where we are today. And we're seeing the numbers go up. We're seeing real danger to people from this Delta variant. We're seeing real danger to our health system. We're seeing the breakdown. And for people to just think that they can come into the country and that we have no rules and regulations and they can do anything they please, I find it completely unconscionable. And if the authorities choose to come down really hard on them, they've got a double thumbs up from me.
Let's talk some more about the cases in Lagos, the rising test positivity rate. What role do you think is the Delta variant playing?
Well, certainly, it's without doubt that the Delta variant is playing a really major role. It's definitely very, very, very much more transmissible than the earlier Alpha Beta variants. It is, it's something that it's a disease, a variant that will infect even those who have had the vaccination. You will not get sick. You may not get sick, but even if you've had the vaccination, you can be infected with it and you can pass it on. So people definitely have to be very, very conscious of wearing their masks, of washing their hands, and spacing out. Now is not the time to return to crowded indoor events. Now is not the time to be careless about wearing a mask in public or in crowded places. And now is certainly not the time not to be fastidious about hand washing or using a hand sanitizer. We must remember that if anybody gets sick with this Delta variant, number one, it's not even age conscious. That means that even younger people are getting it. Number two, is making them a whole lot more sick than we used to see before. And that is really, really bad. And number three, we still have a lot of pressure on the health system from even other things other than COVID. And so this is adding an extra layer of pressure that we really cannot afford to deal with for very long.
Finally, the question has come up, and this is some health experts who say that the situation in Nigeria is slightly different because there's not enough data that tells us, okay, we're recording a third wave and most of the cases are really as a result of the Delta variant. I mean, if we have more data, this should inform our response, shouldn't it?
As it is, the data that we have has informed our response. That's number one. Any more data is just more bad news. But we are doing everything. There is really not much more that we can do that has not been done. The risk communication is going on, and as Dr. Edu said, is going on round the clock in all the areas. Everybody is being made aware. The thing that we need to do is to be able to really strengthen our health system across the country, because Lagos State cannot be left to bear the brunt of it when we are facing all the challenges that we are facing. People simply have to take this thing seriously, at least a lot more seriously, now that more vaccines are available. And as you heard from Dr. Edu, the commissioner for Cross River State, there's very little vaccine hesitancy now because people have suddenly realized that there's a shortage of vaccines, and vaccines are about the only real protection we have against this variant. So anywhere where you can get a vaccine, please go and get a vaccine. And we implore the federal government to make every effort to ensure more vaccines come into the country.
We'd like to thank you for joining us on the program, Dr. Olera Roberts, public health physician. Many thanks again.
Thank you so much for having me.
And the US has donated over 500,000 COVID-19 vaccine doses. It arrived Israelis occupied West Bank and Gaza today as Palestinian officials work to boost uptake and counter a surge in new cases by requiring some workers to get the jab. Let's take a look at more from around the world.
Australia's New South Wales has reported 753 new cases, down from 818 the previous day, although daily infections continue to linger near record levels. Australia has suffered less from the coronavirus pandemic than many other developed countries, with about 44,600 cases and 984 deaths. But a third wave of infections from the Delta variant has plunged Sydney and Melbourne, its largest cities, and capital Canberra, into weeks-long lockdown.
Obviously, our first and foremost priority is to protect human life and to live as freely as possible while we do that. But we also have to accept that there's been no state or nation on the planet that's escaped the Delta strain, that's escaped having cases, and we just have to be real about that. It is confronting, it is scary, but that is the world we're in. That's why we're in a pandemic. It is a plague, a contagious strain of a contagious disease which is sweeping the world, and Australia has done very well compared to the rest of the world. I know that's hard to say when we're going through perhaps our most difficult times here in New South Wales, but we have done incredibly well compared to other parts of the world. The fact that our effective is around 1.3.
According to officials, less than a month into a COVID-19 vaccine booster drive, Israel is seeing signs of an impact on the country's high infection and severe illness rates fueled by the fast-spreading Delta variant. Delta hit Israel in June, just as the country began to reap the benefits of one of the world's fastest vaccine rollouts. On July 30th, it began administering a third dose of the Pfizer-BioNTech vaccine to people over 60, the first country to do so. Meanwhile, U.S. donation of 500,000 COVID-19 vaccine doses have arrived in the Israeli-occupied West Bank and Gaza on Tuesday, as Palestinian officials work to boost uptake and counter a surge in new cases by requiring some workers to get the jab. The Prime Minister, whose Palestinian Authority has limited self-rule in the West Bank, said on Monday that unvaccinated public sector employees will be put on unpaid leave with immediate effect. And finally, Chinese mainland has administered over 1.96 billion doses of COVID-19 vaccine, with the country continuing to ramp up mass inoculation drive. China has extended the range of vaccine recipients to people below 18 years old, following the approval by health authorities in June, authorizing the emergency use of domestic inactivated vaccines amongst people aged between 3 and 17.
You can find more updates, a better understanding of the pandemic. Take a look at our website. It's channelstv.com. You can also find the strategy which guides the public health response at national, subnational levels, and other stories as well in real time. That's the program this evening. Thank you for watching. I'm Millicent Walker. Stay healthy.